Well, good morning, everyone, and you're very welcome as always. It is Tuesday, the 17th of March. Now, if you're a bit pushed for time today, the bottom line is this. Europe and the United States are in the process of shutting all non-essential activities down. It's much the same everywhere. Some countries are being more proactive than others. Some are waiting to react. In the United States, it's largely dependent on the state, as a lot of actions are being taken at state level. So that's kind of what's happening. But my concern is that there's not really an exit strategy for this at the moment. Because if we release the amount of social isolating and containment and locking down, then my fear is that the virus will start spreading again. Because we're really waiting for the vaccine. This is the thing that's going to stop this pandemic. Is we need that vaccine, but it's not going to be here in 2020. So the situation is somewhat open-ended at the moment, really. So I think basically what this means is for the next few months at least, we're going to have to get used to a different way of life. Life has changed in the Western world, and I don't really see much we can do about this. We just have to accept a different lifestyle and try and work together through this as best we can, and that is the key, that we work through it together and we work through it collectively. Now in a moment I'm going to look at some news in more detail, but just to begin with, this is from a nurse in Italy. We are running out of time. There is not enough beds to admit more sick people. We're also running out of personal protective equipment and we have to reuse it. And very often the available personal protective equipment is not suitable and doesn't fully protect us. We are in constant danger. We are aware we could be infected at any time and also bring the virus in our homes and infect our loved ones. Work is so exhausting and demanding that there is no even time to cry. Only at the end of an endless shift, completely depleted of any strength, we allow ourselves to cry. We witness continuous death, but no funerals can be held, and people only grieve isolated and locked in. We are worn out, exhausted, and small in number. In the hospitals and on the ground among the population, we reach people's homes like soldiers at the front without protection. In a region where the health assistance requires far too many to be fulfilled. So there's more health demand than ability to fulfill the health demand. Now, this nurse is saying we are alone. If we don't stop this avalanche, we will pay the highest toll. The failure of our civilized system and anything for which life has meaning. We are in desperate need of hospitals, nurses, doctors right now. Not tomorrow, we need qualified personnel, not improvised young people thrown at the front like soldiers. Dear citizens, we also need you. Lock yourselves in. Any time that you go outside, you open the door to the virus. We can't afford this anymore. Time is up. That's from a clearly emotional and exhausted healthcare worker in northern Italy. Now going on to look at things in a little more detail here. These numbers don't really mean too much, but that is the total number of confirmed cases globally. That is the total number of confirmed deaths, and that is the total number of recovered cases. The world is greatly under testing, so these have very limited meaning. Now, the World Health Organization, which has been criticised in the past in this video, is now making a bit more sense, at least in the words it's saying. Western government's not doing enough. We must know who is infected. Remember the comprehensive approach of the World Health Organization. Testing, contact tracing, quarantine, social distancing. Do it all. Test, 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 test. Every suspected case is the emphasis put on this by the World Health Organization. And again, I conclude that there is grave inconsistencies with what we are doing and what the World Health Organization is advising us to do. Now, European Union declarations starting to come out now. Avoid all non-essential travel. Within the Schengen zone, essential travel for business and essential purposes only. closure of the European Union outside borders. But the reason they're doing this, I believe, is I've heard from politicians is they're trying to reopen travel within the Schengen zone, which basically is a fantasy. So it looks like the European Union officials haven't quite factored in the transmissibility of this virus to me. If they're hoping to reopen the Schengen zone and have free travel within the Schengen zone, I think they are delusional. Now, Russia has had 93 cases, but it's closed its borders, so that's quite proactive. But of course, there's probably many more cases in Russia than are known about by the testing. Now, the situation in the United States. The testing in the United States has been appalling. The real numbers are going to be 10 or 20 times higher than that, unfortunately. And the other thing about the response in the United States is it's been somewhat disparate. It's kind of one state doing this and one state doing that and one city doing this. Whereas I feel we need more, or the United States needs more federal coordination. But the federal government has said no more gatherings of more than 10 people. So that cuts out all sports events. It cuts out all church services, all religious services. No gatherings of more than 10 people. Avoid all public eating and drinking. Bars, restaurants are not for this particular period of time. Separation within the home is advised. Now, quite how you do that isn't spelt out, but if we can separate ourselves within the home, that's what's being advocated by the American federal government at the moment. Now, if someone's sick, the whole household needs to quarantine. And I believe that's for 14 days, the same as in the UK. So one person sick, the whole house needs to quarantine. Elderly advised to stay at home. Now, this was truly distressing. Panic buying of guns in the United States. I really don't know why. I can only assume people are assuming there will be civil unrest. Let's hope that is completely wrong and that people move forward together in this in unity. Because when situations are difficult, that can bring the best out in people. It really can. I've seen it so many times. And I've seen self-sacrifice. And let's hope people move together rather than start shooting each other. Vaccine for a phase 1 clinical trial has just started in the United States. Now, the phase 1 clinical trial, as I mentioned on the German TV interview yesterday, if you watched that, is the first trial in human volunteers. So you would try that in a small number of human volunteers before going on to larger numbers of volunteers, before going on to full clinical trials. So this phase 1 clinical trial is just making sure it's reasonably safe to use, that it's not toxic, that the people don't suffer extreme, unpredicted reactions to it. So great to see that started in the United States. Delighted about that. But it doesn't mean the vaccine is around the corner. It is not. I really hope I'm wrong, but I don't think there's going to be a vaccine in 2020. Antiviral therapies are under development, according to the president. Not quite sure what that means, but certainly encouraging. Now, we believe strongly that there's cases in many African countries now that are already spreading. But if you look at the Johns Hopkins website, you see that there's very few official cases in African countries. So this is a cause for massive concern that there seems to be an incredible degree of underdiagnosis in African countries. And when community transmission becomes established in African countries, a lot of people are going to be infected. The difficulty in accessing healthcare will become even more obvious than it is now, and case fatality rate will rise. So that is really most concerning. The low number of cases officially diagnosed in Africa is very concerning. Now, the UK has got new modelling. Now, this new modelling was done from studies in Lombardy in North Italy, carried out by Imperial College London, who are some of the best epidemiological modellers, certainly in my country and probably in the world. And they've modelled this using new data from Lombardy. And what they've found, I'll tell you what they found in a minute. So that's the cases in the UK, that's the deaths in the UK, that's the active infections in the UK now. So we see it's greatly accelerating, it's greatly increasing. There's a lot more new cases now in the UK because these are still actively poorly people. The real number is probably 50,000 cases in the UK. Now, if that's the case, if that is the actual number of deaths and that's the number of cases, that's more encouraging because in the UK our testing has become lamentable. I use the same word I use for the United States. Our testing has become lamentable. We are not testing as the World Health Organization has advised us to. So this is a massive underdiagnosis. We know there's ongoing community spread and we suspect there's that many cases. Now, if there's that many cases, in a sense, that's good because if we take 55 as a percentage of that number and 55 as a percentage of that one, then the percentage is way, way smaller with that bigger number. So that's encouraging. But most of the cases are still active in the UK that we know about. So that means there probably is 50,000 active cases in the UK now. And the complications of these are probably going to occur next week or the week after. So it is inevitable that the number of cases are going to rise. Not so much the number of confirmed cases is going to rise because we're not testing much, the testing's rubbish, but the number of deaths is certainly going to rise, unfortunately. I don't see any way that is not going to happen. The Imperial College modelling, based on the Lombardy data, they modelled the situation using epidemiological mathematical models. Now these mathematical models are sophisticated epidemiological models that have been largely developed over the past 10 to 20 years to model influenza outbreaks. But they are reliable, fairly reliable mathematical models, so we can take a lot of note of them. And I'm pleased to say that the government has taken a lot of note of them after the rather weak response last week, which we have examined in great detail when we compared the response of the UK government last week to the recommendations of the World Health Organization, and when we saw inconsistencies in virtually every point. So the Imperial College London modellers have said that if we carried on as we were last week with last week's recommendations, there would be 250,000 deaths in the UK. Presumably that's over the next year. So 250,000 people would die if we carried on. But with the social distancing that's now being advised, note as I say, advised, not mandated in the UK, we expect that death rate to go down to 20,000 deaths. So the current modelling is that rather than the 250,000 deaths we would have had we not changed our guidelines yesterday, we'll get that down to 20,000, and we should get the number of active cases down by flattening this curve to levels that the health service can cope with. And a big reason for that reduction in deaths is that these people that are very poorly will have access to healthcare, because we know that access to healthcare is a major determinant in who lives and who dies. This is why I'm so terrified about Asia and Africa. So many people will be getting the complications but won't have the access to healthcare that they need, and as a result people will die because they don't have access to this healthcare. But getting back to the UK, these modellers think if they keep it down to that, they'll keep the curve under what the health service can cope with. I still feel they're being optimistic, but let's hope they're right. This new approach by my government is called suppression. It's suppression now. And the modelling is based on a 75% reduction in social contacts. So what this is saying is the number will go down from that to that if we reduce our social contacts by 75%. That's going to save 230,000 lives if we reduce our social contacts outside the home by 75%. That's what needs to happen to get the number down to that. Personally, I'd like the death rate to be lower than that, of course. At the moment in the UK, doubling time is 5 to 6 days. I noticed quite a lot of empty shelves in my supermarket yesterday. Now, London is already ahead of the rest of the country. So what happens is that one area will kind of... so if that's the number of cases there, and that's time along there. So what might happen is London might kind of might be a bit of ahead of the curve like that. So that might be the number of cases in London, say. Whereas in another city, say Newcastle in the north, then the curve could be behind this. So the curve might be of a similar shape, but it could occur later on. So there seems to be a lot of spread going on in London, a lot of community spread going on in London now. So this is what we're going to see. The numbers are going to increase differentially in different countries and in different areas within a country. This is why I found it so laughable that the EU is thinking about reopening the Schengen zone. So, I mean, this is similar to the situation in Italy now. So I think we're 3 weeks behind Italy with our curve. So this is exactly the same model would apply. So if this is Italy here, and that's Italy's curve now, and this is the UK, it might be something like that. Now, the thing I'm concerned about is, and again, this interviewer on this programme yesterday asked me if the worst is about to come. And the answer is no, not yet, because we're still at an early stage in the growth of this pandemic. So if we assume there's something like, I don't know, suppose there's 50,000 cases in my country now, but eventually by the end of the year, we're probably going to get about 45 million people we worked out yesterday are going to get infected. So this is going to get a lot worse. The numbers are going to massively increase. It is my sad understanding to relate to you now. We are at the early stages of this, and the numbers are going to greatly increase. Now, my government's issued advisory recommendations, and the trouble is with advisory recommendations is it's a bit like the speed limit. Everyone kind of goes right up to the speed limit or goes a bit beyond. I think we need to start mandating more things now. But mass gatherings are cancelled from Tuesday, or what the government has said they won't support them. But that means if there's no police or anything like that at football matches, that means all sport is off basically from Tuesday. Avoid social contact, restaurants, pubs, theatres, sports centres, anything like that. Now highly recommended against. Not mandated against, highly recommended against. But I expect we're going to see individual businesses deciding to close down as it becomes uneconomical for them to stay open. Don't travel. Any infections in the house, isolate the household for 14 days. Now, this recommendation is a most welcome change. Last week's recommendation was woefully inadequate from the British government. Last week's recommendation was that if someone's sick in the house, isolate them for a week, but other people could still go out. I mean, actually quite bizarre when you look back on that now. So you would have one sick person staying at home being self-isolated and other members of the family going out. Anyway, that's finished now. I'm not going to dwell on it. So any infections at all in the home, so any cough, any fever, any reason to isolate someone at the home, then the whole household must be isolated for 14 days. No one should go out the house for 14 days if one family member is ill. Work from home if possible, over 70s. Now, this was a bit concerning. I haven't got any fresh data to give you on pregnancy. And I don't think the government's got any fresh data on pregnancy, but I think, well, it's certainly true that when people are pregnant, their immunity is lowered. Pregnancy is associated with a degree of immunocompromise. So I'm hoping it's no more than that, and that the government don't know of any data about harmful effects to pregnancy that I don't know of yet. So hopefully it's just because pregnant women pick bugs up easier. So over 70s, pregnant women and anyone with health conditions should socially isolate, I would say, from now. I mean, the government aren't mandating it yet, but... And this is the thing that concerns me. We'll need all these measures, but there's not really an exit strategy. So what European governments have done, if they said we'll be doing this for a period of time, for 2 weeks or whatever, but in 2 weeks' time, it's not as if this disease is going to go away. There's going to be COVID-19 all over the place. There's going to be more cases in 2 weeks' time, if anything. So quite what's going to happen here is not clear. I think it means we need to change our ways of life for the rest of this year, until we get a vaccine probably. We just have to accept that life is going to be different and make the most of it. But it is going to be different.